Are you good, Kelly? Okay. All right, we're going to change up the order a little bit today because we do have representatives from Frederick County with us online to present on Frederick County's Crisis Care Center, which we're really excited to hear about. So we're going to start with the presentation so that we're not holding up our guests, and then we'll roll into our agenda. So with that, I will turn it over to Frederick County to do introductions and then get started with their presentation. Thanks again.
Morning. Hi, I'm Andrea Walker. I am the Director of the Behavioral Health Services Division and Chief Public Health Strategist for the Frederick County Health Department. I oversee for this program that you're about to hear about. I bring together all of the key stakeholders and parties. So I'm the Principal and Project Director for the federal funding, which includes both SAMHSA and HRSA. I also coordinate between the county finance, our first responders, our provider, and the construction piece. So I am available to answer any questions about funding, accounting, finance, oversight, first responder coordination, and legislation when necessary. So thank you for having me here.
Should be on the line. 1 moment.
Someone's speaking, but they're muted, it looks like.
I did that.
There you go.
I will try that again. Good morning. I'm Susie Borg. I'm the Director of Crisis Services at the Mental Health Association. And we are the service provider for the Walk-In Crisis Center. And I'm going to get started and just give you a little bit of background. And hopefully the screen share will work. So I'm hoping everybody can see that.
Yes,
and the screen share is working. Great, thank you. So the Mental Health Association is a private not-for-profit here in Frederick County, and we are celebrating our 60th year of service in our community. We have 14 different programs that have services for families, support for child care providers, and then our Crisis Services Division. In our Crisis Services Division, that is made up of a 24/7 hotline, our outpatient mental health clinic, and our walk-in crisis program. Our crisis services started in 1985 with an after-hours line for children, expanded in 1990 to 24/7 when we joined what was then the statewide youth crisis hotline. Our hotline now includes 211, 988, and our local Frederick County lines, but it was the work of our call center that really helped us identify the need for a walk-in crisis center here in Frederick County. So our vision for this walk-in center was to provide crisis-focused interventions in a safe environment for anyone. We recognize that in addition to phone calls and mobile crisis response in our county, there was a need for face-to-face immediate access without barriers such as cost or payment source or type of crisis, that would reduce the unnecessary visits to the ED. In our county, the absence of such a program led to the ED really being the only option if mobile crisis was not available or a fit. And when we started, our mobile crisis wasn't available 24/7 the way it is now. We actually have found since we've opened that 33% of the people who come self-report that if they had not come to walk-in, they would have gone to the ED. So we know that this is working and we're keeping people out of the ED. It's really important for us that the individual determines the crisis. We don't tell them what they have to be going through, and we really reduce the barriers for receiving help. So this is a brief timeline of kind of where we've been and where we are. Late in the fourth quarter of fiscal year 14, with a very small grant from what was our core service agency at the time, and a startup grant from the Community Health Resource Commission, we opened our doors for a total of 56 hours a week, and we served about 320 people at that time. We were available 7 days a week, but we opened at noon, we closed at 8. And so people kind of had to schedule their crisis, which was not as low barrier as we were hoping for. We started with 2 crisis specialists who would meet face-to-face with anyone who walked in our door. The staff is bachelor's and master's level who complete a rigorous training and have experience working with people in crisis. In fact, when we opened, the majority of our staff were folks who had worked in our call center for many years, were in graduate programs, and had experience and training to work with people who had thoughts of suicide and other crisis situations. They were well versed in our community resources and how to get people connected to our local services, and that was important to us. The other thing that was really important to us when we opened is that when people left, they left with something in their hand. So we created what we call a wellness plan, and in cases where it's necessary, a safety plan, so that when people leave, they know what their next steps are and they have a plan of action. We also built follow-up into our program, and we followed up with everybody who would answer the phone, which is actually a lot of people. So we do a pretty robust follow-up as well. And over the next 4 to 5 years, as we're getting started, we're starting to see that our 2 crisis specialist staff is starting to get overwhelmed. The follow-ups were starting to become a little bit of a burden, and we had an opportunity to apply for crisis grant funding through the state. So our LBHA, we started working with our LBHA around conversations about what might crisis stabilization and expansion look like. And we applied for a grant under what was House Bill 1092 for crisis grant funding. We got that award, and that allowed us to expand our hours to 76 hours a week. We knew in our community that we needed kind of a bridge prescriber. So we do urgent medication evaluations. We do not promise a prescription to anyone. We do not have meds on site at the moment, but we can get somebody scheduled within 48 hours with our psychiatric nurse practitioner who can then do that evaluation and get them started on meds while we work to connect them with other resources and longer term care. We added follow-up navigation to help with these connections, and we also added peers to our program. And we were so excited when the state awarded us. We were ready to go. And then, as you might imagine, looking at the date on the screen, COVID happened. In fact, we started our expansion the same week that the governor shut down. So we had to think about what we were going to do. And we added a virtual option, and we had our crisis specialists come into our building here while the rest of our staff went home, and they continued to see clients until we were able to open up and see people in person again. And when we opened, they started coming again. So our conversations with our LBHA continue to progress. And our county identified funding and a new building for us to renovate. And then in October of 2024, we expanded again. We are now 24/7. We're in a new location. We have the ability to have extended care stays. So if somebody needs a little bit more time, possibly while a peer is working with them to get them connected to a longer term rehabilitation program, we have the ability to do that. Since we've opened, we've served over 8,700 unique individuals, and we do keep track from day one. If people return, we count that again. So we've had over 10,000 total visits. There were 2 things that we thought might happen when we opened that we did not see. And one was regular repeat customers. Our guests, for the most part, we do have returns now, but they're usually several years out before they come back with a different crisis. And the number of people who are using us regularly is actually a very small number. Occasionally that happens for little spurts of time, but we are able to most of the time get people connected to other services. So we didn't expect that. And the other thing we didn't expect was that the people who were coming would have private insurance. We were expecting more medical assistance and we were expecting more non-insured, but over half of the people who have come since we've opened have been private insurance. So interesting lessons we learned that way. So this is our new location. And I'm going to share a few pictures just to kind of give you a little bit of a flavor. As you might see, this is one of the ugliest buildings in Frederick County. We embrace that. Behind it, you might see that communications tower that's back there, the flagpoles. It's an older building, and it is seen a lot of life, I guess is a good way to say it. It is a fortress. It is brick and cinder block. And at one point in time, it housed our 911 and emergency management offices. So it was built for crisis and emergencies. um, so, but and our county took on our phase 1 renovations, and they are internal, and they did work that they hadn't necessarily thought to do before, but um, our county teams, like, they've knocked down cinder block walls, they opened it up, they knocked down brick walls for us and created something that looks very warm and welcoming and inviting. So if we can just get people in that front door, you can see that it's a much nicer, prettier space. We have a very open reception area so that people don't feel that they're confined or tight. We have large rooms where we meet with our clients. We have our recliner area, which is over here. Some casual seating in that area too. And then one of my favorite things, I'm sorry, my lights turn out on me. One of my favorite things is our room where we can meet with kids, where we're just trying to make it safe and welcoming for them. This is a little bit, and I'm hoping you can read it, and I apologize if the type is too small, but just some of our sample data from the last fiscal year. We work really closely with our schools, and we started to see after COVID in particular that we were seeing an increase in young people coming to us. A lot of times they will come from our school system. Instead of going to the ED, the suggestion will be made to start with the crisis center, and we will work with the family to try to get a release of information so that we can actually call back to the school, the guidance counselor, and share with them what the plan of action is. That was one of the things that our school system said, we send people to the hospital, we don't know what happened, we don't know how to follow up. So we've been working really closely with them. The majority of our schools in our county will make a referral at some point during the year. Our navigation staff works really diligently to connect services and complete our surveys. And as you can see, 83% in fiscal year 24 report connection to resources. So that's really important to us and a very important outcome. One of the other things, and one of Andrea's favorites, is our wait time, because we all know if you go to the emergency department, you are likely to wait for a while, especially this time of year. Our average wait time in 24 was just under 12 minutes. So people get seen very quickly. Most of the time, an average session is maybe about an hour and a half. Our busiest day of the week changes. It was Wednesday. At the moment, it's running Tuesday. And our busiest hours are always interesting as well. 33% of the children who come would have gone to the ED if not coming to us. And usually our percentage of suggesting the ED is less than 5%. So what we find is really people do not need that higher level of care if we can help them and get them connected to other services. Other data that might be of interest is about 46% of the people in 24 had private insurance. 44% reported suicide concerns and 30% reported substance use concerns. Our prescriber did 135 evaluations in that period as well. And this is where we are through December for fiscal year 25. As you can see, we've moved to Monday as the busiest hour or the busiest day. And our wait time's gone up just a little bit. But we are still running about 86% report connection, and about 98% of people say, yes, I'm feeling better. Things are moving in the right direction for me. So our future plans, we are looking forward to a phase 2 renovation at some point. There is more square footage in our building, and our county is working on this. That will give us a little bit of a change to the outside. We're looking to add a turnaround for emergency vehicles, and where they can access a separate entrance and come right into our extended care stay or extended stay area. We were going to make the outside just a little bit more appealing, and then have some more programmatic space on the inside. We've been working with EMS to become an alternate destination site, and we're hopeful that that will happen in the not too distant future for EMS transports that don't need an ED level of care, and that we can come to agreements about what the screening might need to look like. But our EMS is very on board with that, and everyone in our county really thinks that seems to be a good next step. We are considering the feasibility of implementing the new crisis stabilization regulations to get that specific designation that the state has. Honestly, the staffing requirements in that are a bit of a heavy lift, and it would change a little bit of the flow and the work that we've been doing to date. But at the end of the day, our goal is to be available and responsive and impactful in the services that we provide in our community. And I'm going to stop talking and stop sharing. And happy to answer questions, or if Andrea wants to add anything.
One thing that might be helpful to note is that MHA in Frederick also operates the 988 call center and works closely with Mobile Crisis, which in our jurisdiction is operated by Shepherd Pratt. And so the services, they are considered to be the backbone of our crisis system. So it was a natural fit to continue to build on our already existing infrastructure when we were looking for where this service might live.
Any questions? Any questions for our presenters? Sounds like no questions. Thank you so much for taking the time to present to us. That was very helpful. I really appreciate you joining us and presenting to us today. And I'm going to give one more chance for questions from Baltimore County just while we have our guests here. Okay. Thank you so much. Enjoy the rest of your day. We really appreciate you.
Thank you.
All right, it looks like both have left. I want to open it up to any conversation about the presentation since we just concluded. Quiet this morning.
I'll just say it sounds very good. They seem to have grown and covered a lot of territory, frankly, in a relatively short period of time. And it sounds like they've got a lot of buy-in. I was surprised to hear about private insurance. I was thinking everybody would not have private insurance, and that might be a big challenge. But I guess in Frederick County, that's not really an issue. I don't know if we would find that here. But I thought it was very good.
I'll just, one of the sort of logistical challenges in Baltimore County that they don't, and I'm somewhat familiar with Frederick, that they don't face is, we've got this whole east-west geographic challenge.
Yeah.
So most of they also have a child advocacy center and a family support center. They can locate them sort of in the general Frederick City, outskirts of Frederick City, and it's relatively accessible to the residents there. We always struggle with, if you put it on the east side, the west won't come, vice versa. Put it in Towson, it's hard to find space, and parking and all that. So those, I know you guys have thought about these things, but that's always a challenge for Baltimore County. Like I'm already assuming we're gonna have one. Like that.
It's coming.
I sort of thought that way too. That's why I jumped right away to, I wonder how that looks in Baltimore County in terms
Right.
of insurance.
Right.
But
Yeah, it's a similar, I mean, we're obviously a much larger overall population than Frederick. But the penetration, the Medicaid penetration rate, while higher in Baltimore County than Frederick, it's not significantly higher. So it's a similar mix of those who have employer-based insurance or private insurance, Medicaid, uninsured, those types of things. One of the interesting things about the regulations that she alluded to, and we haven't seen this actually in fruition, come to fruition yet, is the state, when they put out the regulations for the Crisis Stabilization Center service, are requiring that that the provider be able to bill not just Medicaid. And then for mobile crisis, they've actually written it in that the administrative service organization, so the organization that does all the Medicaid billing in Maryland, from an administrative perspective, they are actually, all the providers are being told to bill all insurance types, right? Send it to the ASO. They will hunt down the funds, right? Whether that actually happens, whether they're going to have any sway over the private insurers to say, well, now you have to pay this bill, is to be determined. It just was in effect literally January 1st, right? So it's way too soon to know, but it was certainly a very lofty thought. So, and maybe if it works, then at that point you have a sustainable structure.
And whether earnings are available, still they receive grants from the state from their program, whether that grant is still available.
Yeah, Frederick County, you're right. They get state funds, and they also, as Andrea alluded to, they also have direct federal funding, which is amazing until it's not, right? And so we're just everyone's in that. Oh my gosh, what's going to happen? But yeah, but they've done a very nice job of blending their funding.
Ari, have we gotten, is there any update on the final draft from the consultant?
Yep, we have what is going to be the final draft. It just has to go through everybody says it's okay. And then it'll be, so I'm assuming in the next 2 weeks or so, it'll be ready to actually disseminate.
Do you think that for our April meeting, you'll be ready to share with this group and present on? Okay, perfect. So we'll flag that for the April meeting. Okay, any other discussion on the presentation? Did everyone think it was helpful to see that? Okay,
yes.
great. So we'll roll into our regular agenda then for the approval of the minutes. Did everyone have a chance to review the minutes from our last meeting? Is there a motion to approve? Thanks, Ari. A second? Thank you. All in favor? Anyone not in favor? All right. And then moving on to our committee reports, the Domestic Violence Coordinating Council, I think Amy's online. Is there an update on your committee?
Hello, good morning, everyone. I'm a little under the weather, so I appreciate being able to join virtually. So we had DVCC meeting last Friday. We were able to meet with Suzanne Bailey, who is from the Women's Law Center, who was able to catch us up on some of the strategies that we can provide foreign-born DV victims with immigration services. We were able to meet with Officer Sherry Evelyn, who's the new DVC liaison, and Matt Darnbo with the County State's Attorney's Office for a quick meet and greet. So the only other piece of news that may be new is that we've decided not to put on the DV conference in 2025. We simply can't find a venue that we can afford that will meet all the needs. So we're going to put it off a year and continue to look for resources. We've entertained having some virtual outreach. So that committee is going to meet and discuss more options. So more to come on that.
Okay, thanks. Any questions for Amy? All right, Forensic Mental Health Work Group, Tanya.
Good morning, everyone. We had our meeting on January the 8th, and the highlight of the meeting is that we had a presentation by this organization called Live Benevolent. And one of the presenters had been incarcerated for over 30 years, and he got out in 2013. And he basically was talking about the challenges he incurred as of a person being incarcerated for 30 years with all of the changes that had occurred. He did an awesome presentation, and I ended up having him come to our facility to speak to our guys in the program. And the bottom line was he told them that, if he could do it and be successful, then they could as well. He now has his own business. He does landscaping in addition to working for Live Benevolent. The second highlight was Judge Davis surprised us about the newly established Veterans Court and how we can refer people to that. And a low light of the detention center, what's going on, far as the individuals still awaiting transfer to state hospitals. We have 24 people awaiting transfer. And one of those individuals was on my unit, and he actually tried to spat at my clinician last week because he feels as though we're the problem. And he doesn't understand why he has to wait so long. So we had to move him from the wellness program up to the suicide watch unit because of his aggressive behavior and unpredictability.
Of
So
that
that's
list,
a low
what-
light.
Sorry, of the list, what's the longest someone's been waiting?
I can let you know when I get back to the office. I don't have the exact date,
Okay.
but it's on my spreadsheet.
Okay, thanks.
And it's very difficult to deal with the individual that we have, and then compounded with family. The family think that we are the worst. I try to talk to them, but it's very difficult. Right now, we have 5 chronically ill, and these are people that some of the things they do, you don't want to say in a public gathering like this, but someone eating their own feces is not a normal thing. But we're working with public defender office and the state attorney office. They're ready helping us, and the court psychiatry are doing great, but it's the waiting time to get to MDH. So I don't know. The best thing I can tell you, we're trying our best. Taking a tour on the officers that are assigned in these units. Sometimes they don't want to go in there, but again, that's why they sign up for. You have to be very. So please, whatever all of us do at a high level, we need to do it. But these people are suffering. It's not that we don't have a folks to care for them, but that's not the right place for them.
And I think everyone here understands that sentiment, not that that helps any, but I feel, I come away from these meetings hopeful, but also with a sense of what can we really accomplish and what would that timeline look like? I think that kind of parlays us into the conversation about what our next meeting would look like. I think in addition to Ari's presentation, we'll have the resource map for mental health services available to the youth that our BC Stat team is working on, but I'm interested in what folks at this table think would be beneficial for this group as far as presentations, or I don't want to close out the subject matter because I don't, we haven't made progress. So I want to keep working on it, but I want to utilize our time. So I want to provide an opportunity at this meeting, but also just in the interim, please reach out if you have suggestions of what would be beneficial for this group, because I do want to utilize the minds at this table to see what we can accomplish. So if anyone has suggestions at this point, please speak up, and Lauren and I will do our best to coordinate. One of the things that we are potentially interested in, and Dr. Wilson is working on providing suggestions, is perhaps a hospital representative coming in and explaining from the hospital standpoint some of the challenges that they're facing, because we're so familiar with what we're seeing, but it might be helpful to hear kind of a different perspective. But we're open to other suggestions as well, if anyone has any. And that could be for April or June too. I mean, we can start planning out further if anyone has anything. So please feel free to reach out. I do think that Chief McCullough has an update for us. We'll do our roundtable, and if anyone else has an update, Chief, go ahead.
Good morning, everybody. I just wanted, last week, we held our Major City Chiefs Conference in Washington, DC. And we had numerous speakers, and of course, you can only imagine that the issue of immigration customs enforcement came up. One of our speakers was Tom Homan, who's the border czar. And the Major City Chiefs shared with him our concerns about everything that's been going on since the administration has come into office. And he made it very clear to us and reassured us that two things, that they would not be going into any schools across the nation. They made it very clear that they don't have the capacity or the capability to handle or process children. They have no desire to separate families or anything like that, and that they would not be going into churches or any other facilities like that. They also told us that their primary focus would just be criminal warrants and criminal persons. Their focus is on the most serious violators and offenders, and they understand that most law enforcement agencies across this country aren't equipped to support an immigration customs enforcement mission. That our mission, is different than their mission. There was quite a bit of conversation and concerns expressed to Mr. Homan. He was very understanding of our position in terms of corrections. He reassured us that there were some comments from some agencies that they, in fact, were already making proper notifications to Immigration and Customs Enforcement, but that there was a delay in them coming out and picking up the prisoners, which put the detention facilities in a tight spot, and many times they were often left releasing these people, and then Immigration and Customs Enforcement would have to go look for these people. As a result of us informing them of that, he assured us that he was going to go back and have conversations with his people, and his directive to them were going to be that when they were notified of these people being held in detention, that it was their responsibility to immediately respond out and pick these people up. So I think as a county, I think we've taken the proper posture in terms of waiting, seeing. We've been very deliberate and cautious about moving forward. From the police department's perspective, we've received numerous complaints and a whole lot of angst from the community about ICE being seen around specific schools and stuff like that. We've investigated those, looked at those issues. We've never found that ICE was actually out in the community, going to schools, going to churches, or conducting any targeted activities, nor have our agency or our people been involved in anything that's been a targeted activity by ICE. So I think at this point we're doing the right thing. We're moving in the right direction. And once again, even when they've done their targeted activities, initially they were targeting criminals, and if there were other undocumented persons that got caught up in the net, they were actually taking those people in. Well, they found out that they don't even have the capacity to handle those additional people or to process them, because they actually don't have enough detention space. They actually rent detention space from everybody else across the country. And it's to the point where there's not even space for them to rent. Of course, we've seen in the news where they're looking at using Guantanamo Bay. They're putting up tents and things at Guantanamo Bay to put undocumented persons there. That's pretty much it. Any questions?
Thank you, Chief, for that update. Any other updates? All right.
I just want to comment on something from our community, the Liberian community. There are a lot of folks that now not going to grocery stores, especially those ones that are run by Liberians or African stores. Even our church attendance have gone down. So we who are leaders in the community are going around and talking to people. If someone call the police, if they come to your store to harass you or to ask you the question, call the police. Say, we're here, especially if they know you work for Baltimore County government. Everybody call me the Liberian or Hillary. They probably call Hillary. I said, I'm not a police. But you get trying to encourage people, go about your normal life. If something happened, call the police. Our church on Sunday, I had to go there and talk to people, and I just started calling members that are regular, but they're afraid that I say, if you have immigration problem, go settle it. Especially for Liberians, they have TPS, they have not canceled it. So I say, go and process a document. So we're trying to encourage folks in Baltimore County, in Baltimore City. I didn't get to go see the game until late. I was going to visiting people, get talking to them. So.
No, and that's a good point. As a police agency, what we're trying to do is try to alleviate people's fears. So we've been going out, meeting with various communities. If you all need us to maybe come out and address the community, we're glad to do that. It's just one of those things, I think, as a county government, as government, we need to alleviate the concerns and the fears of our citizens, because especially in the school system, has really been impacted by the number of kids that are just afraid to go to school or to go out because they're afraid they're going to get snatched up at school, separated from their parents.
Yeah, we were hearing from the local ICE director that they wouldn't be going to schools and churches, but it's I think comforting to hear that that's what you were hearing at your meeting from the top.
From the top.
Yeah, and if we can kind of push out that message too, to help people feel comfortable going to church and school and going about their daily life, I think that's helpful information. So thank you both for sharing.
I think as long as people go about their normal business and they're being good citizens, I don't think people have any real concerns. I think it's really the people that are getting caught up as the ones that are committing crime.
Chief, I got one question for you. Looking at it from recent, directive from the Attorney General, how do you interpret that in terms of policy you just outlined? In terms of
What do you mean specifically?
Well, he outlined some things, and there's some things in there that question we've been asked, but we basically rely on you guys to kind of like help us understand how you interpret it. Because right now it's pretty much, as you stated, I understand there's some back and forth going on in terms of the language, but the question is in terms of their position.
Well, what I try to do is keep it simple for the people, for my people, the police department. My message to everyone has been is that we're gonna follow county policy, one. Number two is that we're gonna go about our normal course of business and how we normally conduct business. The reality is that we can be put in a situation where, once again, if Immigration and Customs Enforcement they're actually conducting, first of all, I tell everybody, we're not going to participate in any directed activity by them that's focused on immigration policy or immigration issues, because that's not our mission. That's not what we're here for. However, situations can arise where an emergency situation involving one of their activities or any activity by them, where they could directly become under attack or some criminality becomes involved that might warrant and require us to respond and to assist. We will respond, we will assist, we will perform any and all of our law enforcement responsibilities, whether it's patrol or whether it's our special operations.
Well, we're willing to intercept many of those questions from citizens walking in the courthouse. Quite often we get those questions rather than sending to the 6th precinct. We'll take care of it.
Yeah, I mean, I think the biggest thing is take an approach of that we're gonna operate as usual, status quo. If emergency situations arise with them, we're gonna support them because that's our responsibility to do that. But in terms of engaging in directed immigration and customs enforcement activity, we're not gonna do that because that's not our mission. It doesn't fit into our mission. And of course, these days, who really has the resources? I know, we have more resources than you have, so I know you don't have the resources to be involved in that.
We'll kind of get the same kind of questions our correction partner get from the community when they come into the door and ask questions about it. Because of course they figure the courthouse has all the answers.
Yeah, but and the reality for all of us at the table, most of the immigration questions really arise once they're in detention. And I think they do a fine job, well, you guys have been doing a fine job in addressing those issues.
Thank you. Any other roundtable updates?
May I ask, Chief, I don't know if at this stage, I know it's fairly early on into the new policies and focus of the new administration, but have you noticed any drop off in your calls for service? So for example, do you find that people who may have been victims of a crime are reluctant to call the police out of fear that they think somehow this might lead to other consequences that might have impact on immigration or ICE?
I think it's early on. I don't think there's any empirical evidence of that right now. I think it's one of those things that we're going to have to see down the road. There are other phenomena that I won't go into today, that we're monitoring. I'll use this as an example. We always monitor the nature of crime in Baltimore County. So if you take the Hispanic Latino community, initially when they came into Baltimore County, they typically were the victims of crime. And they were usually victimized by an outside group. Over time, we started to see them not only as victims, but as suspects in crime. And an interesting phenomenon in that community now is that there's an increasing amount of crime, Latino on Latino, Hispanic on Hispanic crime in Baltimore County. And it's something that we've been monitoring and tracking as an agency and trying to work on developing strategies in those specific communities to deal with. So when we look at things like homicide, non-fatal shootings, their numbers are actually increasing there.
Thank you.
Well, we're ending a little bit early, but we didn't want to overbook. And I think the conversation's been healthy, so I appreciate everyone being here and being present. Ari, we'll plan on you for April, and we'll have the BC Stat team here. Again, please reach out with any suggested presentations or any ideas that any folks have. We're certainly open to suggestions. And then with that, is there a motion to adjourn?
So moved.
Thanks, Hillary. Is there a second?
Second.
Thank you. All right. Have a great day, everybody. Stay safe. No.